A very good morning, ladies and gentlemen. Kindly take your seat. We are about to start the day's program. And I request everyone to kindly put their mobiles on the silent mode. Ladies and gentlemen, on behalf of the organizing committee, I extend a very warm welcome to you all. The Cologne Cancer Symposium 2025 is jointly organized by the Tamil Nadu Gastroenterology Trust and Apollo Hospitals. This month, being the Cologne Cancer Awareness Month, this program has been organized for more and more people to be aware and act at the earliest for a quality life. We now begin the day's program, and I invite Dr. K.R. Palanisamy, the Senior and Head, Department of Gastroenterology, Apollo Hospitals, and the President of the Tamil Nadu Gastroenterologist Trust, to kindly come over to the dais. Along with him, I invite Dr. Shyam Varadarajulu, the President of the Orlando Digestive Health Institute, Dr. Evelyn Decker, the Head of GI Oncology, Amsterdam, Dr. Mo Tawfiq, Consultant Gastroenterologist from UK, Dr. Bharat Somasundaram, Consultant Gastroenterologist from USA, Dr. V. Raghuram, the Senior Consultant from Chennai, Dr. L. Venkatakrishnan, Consultant Gastroenterologist from Coimbatore, Dr. A. Ratnasamy, the Senior Consultant Surgeon from Chennai, Dr. Ubaldus, Consultant Gastroenterologist, Apollo Hospital, and Dr. Satyabama, the Group Director and Clinical Advisor from Apollo Hospitals. I request everyone to please come over to the dais. And I request Dr. K.R. Palanisamy to give the welcome address.
Very good morning to everybody. I welcome you all to this important the awareness program. You may be wondering why I called you all for this program. And you must have read in papers yesterday and today, and it has been published both in print media and came in the TV also. This program is organized mainly to create awareness about the colon cancer. I think most of you may be aware this colon cancer is preventable, treatable, and curable. That's very important. And some of you may not be aware of this. And I just would like to quote some examples. And in fact, the 40 years back, I saw a patient. I diagnosed him as a colon cancer. And he was operated. And today, even now today, he's living normal. On the contrary, there are some youngsters, beyond 40s, late 40s, 50s. They suffer with this. When they get this problem, initially itself may be an advanced disease where our treatment options are limited. So in spite of all the advanced treatments, they will not survive long. So because of this, to create awareness and also to educate the public about the importance of the preventive health checkup and regular screening colonoscopy, that's what is the main, most important thing about this meeting here. And in USA, in America, it is compulsory. Everybody should undergo a colonoscopy after the age of 45. Why it's compulsory? When you do a colonoscopy, you pick up a small polyp. That's a non-cancerous tumor, and that can be removed by colonoscopy, so that by you can prevent a cancer developing. On the contrary, if you diagnose an early cancer, if you operate, it's curable. That's most important. So I would like to dedicate this program in the memory of Shyam Kothari, and whom we lost him 10 years ago with this problem. When we diagnosed the problem, it was fairly an advanced disease. In spite of advanced treatment in the US, we couldn't save him. So with this brief introduction, I would request my course coordinator, Dr. Shyam Varadarajan, to say a few words.
And good morning and welcome and thanks for being here. This is important occasion because in the Western society, colon cancer has been not conquered, but giant strides have been made. Now, the problem with the disease is that it's afflicting younger people, and more younger patients are getting colon cancer, although the older generation is fairly preserved. It's a preventable disease. You have to just undergo timely testing, and it's word of mouth. I think we are all from the same state. This is a place that we love most, and I would hope that this is a place that will start making small strides, such as incorporation of guidelines, so that we will be an example as we are. Because if you look at it, Tamil Nadu is one of the most progressive states in the country. There is no denying. And I think not only should we be very successful in what we do in the corporate world and agriculture and other sectors, but also in healthcare, primarily preventive healthcare, because it's our social responsibility. And everybody in this room are very highly respectable people who are actually role model citizens. So hopefully, this is a good day for us to move this mission forward. And Dr. Palaniswamy is probably one of my closest friends in my life, a personal friend, a great professional acquaintance. And hopefully through his leadership, this will move forward. And most importantly, thanks for taking your valuable time on a Sunday to come here and listen to a bunch of doctors talking about a lot of things that you probably find it difficult to understand. But thank you so much.
Thank you very much, sir.
So now we would like to give a brief presentation on various aspects of this colon cancer, and followed by we'll open up for the discussion. Can call.
May I now request Dr. P. Paramanayagam, the Senior Consultant Gastroenterologist, Apollo Hospitals, and the Secretary of the Tamil Nadu Gastroenterologist Trust, to give us an overview on the Trust's activities.
Morning, sir. Good morning to all the dignitaries on the dais and eminent persons who are in the room. It's a proud privilege for me to be speaking in front of you on this occasion. So this program is organized mainly by the Tamil Nadu Gastroenterologist Trust. I'm here to share a few words about what the trust activities have been in the last few years. So that gives you an outline of what has been the trust's focus. So this was formed in the year 2003, and it was founded by Professor K.R. Palaniswamy and late Professor Dr. V. Balasubramaniam. We lost him about a couple of years back, but he has been the backbone of this trust as well. So the founder members were here, the emeritus member here, Dr. Colonel Krishna is here. Apart from that, Dr. K.R. Palaniswamy, Dr. V.G. Mohan Prasad is the Vice President, Treasurer is Dr. Prem Kumar, and senior members who have guided this through are Dr. Raghuram, Dr. Chakko, Dr. Ratnasamy, and Dr. Mohammad Ali, and Dr. Ubal here. So the focus of the trust has been to promote and improve the quality of gastroenterology in Tamil Nadu. The trust conducts regular scientific programs with both national and international faculty, and it also conducts good community awareness programs in association with many organizations, including the World Gastroenterology Organization, apart from improving and imparting education in the form of giving grants to postgraduates in the field of gastroenterology, and some support to needy patients also who are suffering from GI disorders. So just a brief overview. One of the most successful meetings that was conducted by the Trust was in 2011, where the focus was on train the trainers. This was mainly a meeting to train the educators, who are the doctors who were going to be teachers for the doctors in the colleges and in the postgraduate institutions. Subsequently, in the Endoscopic Ultrasound World Congress was conducted in 2014 at Chennai. I think the course director again was Dr. Shyam Varadarajan. It was a very successful meeting. We had about 600 faculty delegates coming in to attend this congress. It was also supported by the World Gastroenterology Trust. And during the COVID also, there was an online CME on obesity, which was conducted. And again, yesterday we had a very successful symposium, a CME program on colon cancer. It was conducted yesterday, where we had 3 international faculty of 2 who are here, who enlightened us about this disease. Apart from this, in the academic field, Trust is also running. Very few trusts are actually able to conduct this, but we are holding a significant academic publication in the form of a journal that comes in quarterly, and that has entered the 5th year of publication. And that, I think, is one of the significant landmarks from the Trust Society towards an academic program. The community programs are equally vibrant. Dr. K. Palniswamy always conducts his annual gastro camps at his hometown in Kallipatti. It has been going on every year since 2011, except for the couple of years during the COVID in which we had to stop. And it is well attended by close to about 500, 600 village residents come and participate every year for their annual checkup. Apart from this, it has also supported screening in school students for preventable diseases like hepatitis B, and followed by screening, they are also been vaccinated, those who have not had their shots earlier. And similar to what we are having now, they've had public interaction programs in 2012 and in 2017, during which common digestive disease related disorders were discussed. The same was also done in 2023 at Kallipatti. And he has also conducted a walkathon for awareness on liver cancer. One was conducted in 2013 in Marina Beach here, and also at Ooty. Apart from this, as was discussed, the focus of this trust is also to improve preventive aspects of health, and I think one of the focus should be on school children to impart awareness about the hygiene and the health. So doing that, here we see a community health program where the discussion is with the school students. Apart from that, the Trust also supports postgraduate academic research activities by providing grants, and also supports some needy patients. Thank you so much, and over to the please. Thank you.
Thank you very much, Doctor. May I now request Dr. N. Tirumurthy, the consultant gastroenterologist from Cancer Institute, Chennai, to brief us on the studies conducted.
Good morning. I'm in Cancer Institute, Adyar. Basically, I'm here to mention about the topic. This thing is colorectal cancer is preventable, curable, and it is, if you diagnose early, we can treat it. That is what I want to say, some few points how to diagnose early the colorectal cancer. Because if you pick up the cancers early, it is the treatment and cure rate is very high. And second point is why we are not able to pick up, because in the early stages, the colorectal cancer may not give you any symptoms. Especially the point is in general, everyone thoughts if you have some problem, then we have to go to the doctor. Otherwise, if I am not having a problem, you should not go for that. That is what the general opinion. But almost all cancers, especially our GI tract cancers like esophagus or stomach or colon cancers, in the early stage, they may not give any symptoms because it is a tubular organ. It is like a balloon. So if you are developing any cancer in the early stage, it is not going to give you any trouble unless otherwise it progresses further, it causes some kind of block, then they are bleeding. So our aim is to pick up the early cancers. For that, we have done a small study in our Cancer Institute, how to pick up. For colon cancer, whenever it forms in the early stages, usually some amount of bleeding, blood leak will be there. That will not be visible in the stool. So we have to pick up that invisible blood in the stool. That is what our test is aiming about. So we have done a study around in 2000 volunteers. They are the first relatives of the proven colon patients. We asked for the permission. They volunteered around 2,000 people. We have done a blood test, invisible blood in the motion. So we picked up some positive cases and we have done a study and we found some results. The basic idea is we have to pick up the cancer in the early stage, for which there are facilities available, especially for a colorectal cancer. Simple stool test to pick up the invisible blood in the stool. But another important question will come, suppose if I have an invisible blood test positive in my stool, then does not mean that it is a cancer. The test detects there is invisible blood, then we have to find out what could be the cause. There may be other causes as well, but our aim is to pick up the cancer early. So don't think that my blood motion test comes positive for blood, that means it is a cancer. No, it is not like that. It detects the blood and go for a further testing, colonoscopy, and if it is everything is fine, then it is okay. Otherwise, we pick up any lesion, we can cure the disease. So it is colon cancer is totally preventable by simple motion test looking for an invisible blood loss. That is one thing. Another important thing is we have to do this invisible blood test, the invisible blood in the stool test in patients, those who are having low hemoglobin. Because of the invisible blood loss for a prolonged period, usually the individuals will develop low hemoglobin. So those who are having low hemoglobin, especially iron deficiency anemia, they have to do the stool Huckel blood test. That the test is called stool Huckel blood test. That will be very much useful. So we are planning to take this study further in a community level. We have done it only the hospital level, so we will take it in the larger setting. Why we are doing this? Because the colorectal cancer incidence is increasing in India. So it is gradually increasing because of the various factors, lifestyle factors, obesity, diabetes, a lot of things. So it is increasing. So if you have some proper screening program, that is screening is detecting a lesion before going to the advanced stage or something like that. That is screening. So we have to have a screening program. Western countries, they have a screening program. They have to undergo annually, they have to undergo the stool test, and once in 5 years or 10 years, they have to undergo the invasive colonoscopy, that is passing a tube into the colon and looking the colon. That is a compulsory. But in India, the cancer number is increasing, but we have no program. So for that, we have to have a data, how many patients are really having for that. But please all remember, it is a simple test which can detect any pathology very easily, especially cancer. Thank you.
Thank you, sir. I request Dr. P. Basamani, the Senior Consultant Gastroenterologist from Apollo Hospitals, to speak on colon cancer.
Good morning. I thank Professor K.R. Palaniswamy and all of you for taking time off and coming here. So today I will explain in the next 5 minutes what this term colon cancer or bowel cancer means. As long as we live, we need to eat something. The moment we stop living, we will be eaten by something else. So the food we eat needs digestion, and where our fluids and nutrition is absorbed by the small intestine, which is 7 to 9 meters long. But the highlighted part is the large bowel or colon. It is short but broad, so it's called large intestine. When we say bowel cancer, we refer to cancer that can arise from any of the highlighted area. Why the cancer commonly occurs unlike like heart? No. The heart cells live forever. No, they don't need to reproduce. Whereas because of all the hard work the colon does, it needs replacing every 2 days. When we make lot of copies, we are liable to make mistakes. And if you are born with some basic mistakes, then more mistakes accumulate and that becomes cancer. And it is a slow growing process generally. So the bowel lining, when it makes a mistake genetically, when it is replicating, that gets amplified and then it grows over several months to few years to become a cancer at the far end where it becomes life-threatening. So when the problem is small, like an unwanted weed, it is easy to eradicate it when it is young and small. When it becomes like a bad tree, then it takes a lot of effort, but you might get damaged by in the process. So worldwide it is third, but in India it is fourth largest cancer. The good news is if we can pick it up early, then 95% will be cured. So majority will live for 5 years, 95 of them. In the intermediate stage, it drops down to 70, But if the cancer is advanced when we diagnose, then only 1/4 will live for 5 years. So, and worryingly, even young people, no, even a 40-year-old person with a new change in their bowels, when we do colonoscope, we pick up cancer. And 1 in 10 colon cancer diagnosed nowadays, people are younger than 50, 40 to 45, 45 to 50. And 1 in 4 rectal cancer. Rectum is the lowest part where the motion, the bowel motion just exit out of our body. So this could be due to the changing lifestyle, a lot of antibiotic exposure as a baby, eating ultra-processed food which lacks fiber, because fiber is the food for the trillions of bacteria living in our intestine, especially the large intestine. If we eat processed food, we starve our own good friends, trillions of friends, and bring harm to ourselves. And other lifestyle measures like obesity, smoking, and alcohol. So when should we suspect? Irrespective of the age, if any of the symptoms like belly discomfort, blood in the stools, change in the frequency or the shape of stools, new change in the bowel habit towards diarrhea or constipation, sense of incomplete evacuation, increased bloating and gas, and unexplained weight loss, especially iron deficiency anemia, all those things should ring a bell. Doesn't mean anybody who is having these symptoms is having bowel cancer, but anybody who is having persistent symptoms should be thought about having an underlying disease and worked up. The 70% of the bowel cancers, we call it sporadic. They just pick up randomly, one of us, whereas 30% the risk is bequeathed by having one of the relatives. What is important is how close they are as a relative, first degree or second degree, how many of them got affected, and what age they were affected. All this will factor into how seriously we should put them on the surveillance program, because surveillance is for people with high risk. Screening is for people with no symptom at all. Screening is for not for anemia, not for people with the blood in the stools. Those are symptomatic investigation. One of you are a bit above 45, if you have nothing to complain about, and if you opt for something to test for colonic cancer, that is screening, and that is what we are trying to bring across to you. So if you have a family history, then we should think about getting screened 10 years earlier than the youngest relative that was affected. For all others, the current recommendations begin at 45. One colonoscopy gives 10 years warranty, so every 10 years is enough unless you get too old or get fed up with the colonoscopies. So why this? Because we all know that prevention is better than cure, and worldwide, Europe and US have demonstrated by doing colonoscopy, identifying the polyps, which are the left-hand slow budding abnormal cell growth, which can become cancer. By removing it, we are stopping the whole process, and the survival, the occurrence of cancer is reduced to only 10%. Until then, we can live healthily and mitigating the risk factors. And there are treatments for every stage of cancer, but we insist on picking up early and removing it, even preventing from cancer. And the message is, by you people listening, going and speaking to your relatives, and spreading the awareness, and together we can win as a team. Because bowel cancer is preventable. When detected early, it is curable. But whatever stage the patient comes, we can offer treatment, palliation, and comfort. Thank you very much for your attention. Thank you.
Thank you, sir. I now request Dr. Karthik Natarajan, consultant gastroenterologist from Apollo Hospital, to brief us on the colonoscopy procedure.
Good morning to all. I'm just going to talk about colonoscopy, a brief outline. So what is colonoscopy? It's a medical screening procedure that uses a flexible tube with a camera at its tip. It's also called as a colonoscope, to examine the inside of the large intestine, the parts of which are the colon and the rectum. So it helps to detect abnormalities like polyps, which are small growths, as was highlighted before, cancer, inflammation, infections. And the procedure allows the doctor or the gastroenterologist to see the entire colon and take biopsies if needed. It is typically performed under sedation for patient comfort, but that said and done, most of the procedures that we do are unsedated in India. So typically you will have a tube being passed into to study the entire length of the intestine, and it's just a daycare procedure. It's done in a matter of a few minutes. Has it been shown to prevent cancer and actually save lives? The answer is yes. It accomplishes this by removing the polyps, which can progress to cancer, and detecting cancer very early, so you won't have advanced disease. So what is the preparation? Before the procedure, we follow a simple diet, liquid diet prior to the procedure, and we'll give something called as a bowel prep to ensure that the colon is clean. After the procedure, the recovery time is around half an hour to 1 hour, following which the patient can return back to normal activities the same day. But if the patient underwent the procedure through sedation, we'll tell to avoid heavy activity, heavy weightlifting or driving. The importance of screening is, like we mentioned before, to detect cancer early, to identify polyps and remove them at the same time, and reduce mortality by doing the same. This is just an example of a polyp which can be removed at the same setting by a device called a snare. We have many such accessories which help us to remove it, and after that you can go back at the same time. There's no risk of any adverse events. It's bare minimum, to say the least. So why aren't people actually having it? So there's many surveys done across in the West. Some of them said that the doctor did not discuss it with them. The most common reason for fear was fear of or avoidance of the preparation or the prep, which causes just a temporary period of loose stools. Some of them were worried about it. Many people are simply unaware that they need colon cancer screening. It's perceived to be a difficult procedure. When you have a tube inside the rectum, not everybody is going to like it. In fact, nobody will. Not many people are aware of the importance of the procedure and the safety profile. So, of course, like artificial intelligence is getting into every field now, we also have artificial intelligence being incorporated into colonoscopy. It's being used to help detect or spot polyps more easily during the procedure. In fact, in yesterday's meeting, something that we discussed is if we have to incorporate a screening colonoscopy program in India, it's going to be nearly impossible to screen the entire population at risk, because we have a population of more than 140 crores. How do we actually do it? So artificial intelligence, in fact, makes the procedure a bit more easier. You can spot polyps more easily. You can quickly analyze. It reduces the chances of missing certain lesions, and more accurate decisions and better outcomes. We have this artificial intelligence program incorporated in our scope at Apollo. If you see on the picture, sorry, I have a pointer. So if you see over here, you actually cannot spot the polyp at all, but I don't know if it's visible here. It's over here, and that is highlighted by the artificial intelligence program. Similarly, if you see our worry in this procedure while conducting the procedure is this whole motion. So we'll actually tend to miss the small polyp over here, which can be highlighted by the AI program. This is incorporated with the Olympus technology, so it's called EndoAid. AI so it's EndoAid. It's called CAD-E. So what do we do next? Now that we need this program, we need to create more awareness, which is what we have been doing over a period of time. Something like, patient testimonials, people coming forward and saying, yes, I've got the procedure done. People who have been survivors coming forward and saying that, get it done before it's detected too late. We see these ads routinely all over, until it's made a nationalized program, we're never going to get forward with it. So, if you step into a movie theater, you'll see these ads. I'm not going to take names. Last year, actually, we, as part of spreading awareness, Dr. Palaniswamy actually organized this meeting with the Chief Minister to release a document on screening colonoscopy. It's compulsory in the West after the age of 45 years. And I think everybody should get it after once they're 45 or earlier if they have a family history or risk. Thank you very much.
So now we'll be playing some videos of patients who suffered with the cancer. And this is a very different types of cancer. I think this will give a good message for all of you. Can we have a videos, please?
Hello everyone. My name is Shivaraman. I am 77 years old. Before I proceed, here is a disclaimer. This is not a paid promotional video. I have been doing master checkup at Apollo Hospitals, Greaves Lane, Chennai for many years now. During 2019, my younger brother was diagnosed with advanced stage of colon cancer and had to undergo an emergency operation, removing major portion of his colon. In spite of the best medical treatment after that, he passed away in 2021 at the age of 69. Being his brother, I was advised colonoscopy, which I did with Dr. K.R. Palaniswamy at Apollo in 2020. As per his advice, after 5 years, he did the second colonoscopy in February 2025. Fortunately, everything is normal for me. Preventive procedures like colonoscopy are extremely helpful in early detection of serious illnesses like cancer before they advance into complicated, life-threatening stages. It is not expensive and can save your life. I am very happy with the caring and professional services of a very senior doctor like Dr. K.R. Palaniswamy and his entire team at Apollo Hospitals. I urge all of you above middle age to undergo colonoscopy and save your lives. I wish every one of you good health and happiness always. Thank you.
Hi everyone, I am Suresh Babu. You are all aware that due to lifestyle changes and eating habits, many of the youngsters and middle-aged people are getting a lot of digestive issues, and sometimes it leading to colon problems, colon cancer, by threatening their financial positions and home situations. So there is a need for taking corrective action. One thing could be after getting a certain age, or as and when people are having a serious issues or doubt on their digestive problems, it is better to get preventive measures by you doing colonoscopy or endoscopy, etc. In my own case, in 2015, I have bowel movements issues and pain in the lower abdomen. I have consulted Dr. K.R. Palaniswamy, senior gastroenterologist in Apollo, Chennai, Apollo Greaves Road, Chennai. He has advised me and he has checked me, he has done scopy, and I was under medication, I was under constant examination in a frequent intervals by doing a scopy. Because of that, in 2017, when a small tumor was detected, immediately hemicolectomy was done and I became normal. Even later also, 2020 also, because of continuous follow-up, I had another small surgery done by which I am leading a normal life and happy life. So what I advise everyone is to get frequent checks, frequent scopies done, and keep your health and colon safe, and by preventing colon cancers and other serious issues. Thank you.
Hello, hi. I'm very happy to be here in a foreign country visiting my relatives. It's all because of Dr. K.R. Palaniswamy and Dr. P.K. Reddy and Dr. Shankaran Srinivasan, the oncologist and the gastroenterology team from Apollo Main Hospital in Chennai. it is not too late. What I would say is the diagnosis of earlier cancer is curable now. There should not be any fear. Many years ago, cancer was considered as a very deadly disease, and as of today, I think people should make sure that they visit the doctor and consult, and even if there's a slightest indication, they should not avoid. They should visit the doctor and hospital to make sure that they are physically examined. 2007, I had similar symptoms and I was not too sure, but luckily it was an earlier stage. Then I could walk into Dr. Apollo, Dr. Krishna Palaniswamy's clinic, and it was his intervention, his diagnosis, his biopsy proved that I had colon cancer, and within a fortnight, the medical team from Apollo, Dr. P.K. Reddy and other, suggested me, and they got me operated. And soon after that, I was, the chemotherapy was continued under the guidance of Dr. Shankar Srinivasan. I must be thankful to the entire team, and because of their earlier intervention, earlier suggestion and diagnosis saved my life. Today I'm happy because of them. So it is not at all too late. I would suggest that if someone has any kind of symptom, let it be anything, just immediately go to the doctor and then have a physical examination and then make sure that your life is saved. Cancer is not a disease at all, absolutely. And then one can be cured as long as, they just go to the hospital and have it checked up. And wishing the symposium and the team as great success. This is Sethuraman from Australia. Thank you.
Hi everyone, my name is Shahid and I'm here to share something very personal but incredibly important, how early detection saved my life. In 2023, during my routine annual health checkup, I had no symptoms, no warning signs, just another regular screening. But that screening led to a life-changing discovery. I was diagnosed with sigmoid colon cancer. Hearing the word cancer was terrifying, but looking back I realized how fortunate I was. Because it was caught early, I had options that I might not have had been there if I had waited. Thanks to early detection, my medical team was able to act quickly. I underwent surgery to remove the tumor, and because we caught it early, the road to recovery was much smoother. It wasn't easy, but having that early intervention made all the difference. That's why I can't stress this enough. Get screened. Colon cancer is one of the most important preventable and treatable cancers if detected early. Don't wait for symptoms. I didn't have any, and yet that routine checkup saved my life. I'm standing here today not just as a survivor, but as someone who wants to help others avoid the worst. So please prioritize your health. Get screened. It could be the decision that saves your life, just like it saved mine. Thank you for listening, and I hope my story inspires you to take action. Stay healthy. Stay strong.
வணக்கங்க. மார்ச் மாதம் மலக்குடல் புற்றுநோய் விழிப்பு மாதம். மலக்குடல் புற்றுநோய் வராமல் நம்ம ஈஸியாக தடுக்க முடியும். என்னன்னா சரியான டைம்ல அதுக்கான செக்அப் பண்ணிக்கணும். அந்த செக்கப்புக்கு பேரு கொலோனோஸ்கோபி. அதை பண்ணிட்டோம்னா நம்ம மலக்குடல் புற்றுநோயை ஈஸியா டயக்னைஸ் பண்ணிட முடியும், அதை கியூர் பண்ணிட முடியும். நானும் கொலோனோஸ்கோபி பண்ணியிருக்கேன். அதனால தான் நான் உங்களுக்கு எல்லாருக்கும் தெரியப்படுத்தணும் அப்படின்னு ஆசைப்படுறேன். அதனால கரெக்டான டைம்ல எல்லாரும் இந்த கொலோனோஸ்கோபி பண்ணிக்கணும் அப்படின்னு நான் உங்களை வேண்டி கேட்கிறேன்.
I hope all these videos must have given an important message for all of us. The next I'm going to invite on Mr. Venkat, and he's a friend of mine. He used to be associated with me conducting all the meetings from 2003. And he's a tennis player. And he developed colon cancer, rectal cancer. He just presented with bleeding, blood in the motion. On examination, he had a colon cancer. He will be sharing his experience with you. Venkat, please.
Good afternoon to all the esteemed delegates here and also all the family of cancer. My name is M.S. Venkatachalam and I'm 76 years old. In 2021, I had blood in my motion and my stools were thin, worm-like in shape, very thin. And I consulted Dr. K.R. Palaniswamy, who did a colonoscopy and told me that I had rectal cancer, which was confirmed by a biopsy. I had radiotherapy and chemotherapy for 4 months. On 24/1/2022, I had been checked with a PET CT scan and sigmoidoscopy, which did not show cancer in the rectum. The whole body PET scan, CT scan was normal. What happened here was, after the treatment, my face became completely black. My skin was black, my nails were black, and some of my family members are there too, who supported me as family pictures there, but please see my face there. And now you see me as I am, clean with all fingers clean, everything. Another 4 months later, I started playing tennis at the club. Throughout 2024, till date, I have played 10 International Masters Senior Tennis tournaments. I am now, God willing, highly likely to be selected to play for India in October 2025 at the World Championships to be held in Croatia. A few of my trophies from the International Tennis Federation tournaments. Then each day is a beautiful gift of God, and request each and every one of you to give thanks and cherish every moment with your loved ones. Don't stay stuck at home. Please call a friend or relative and go out for small walks. If this is not possible, please walk in your own flat or on your terrace. Keep yourself cheerfully occupied with things you like to do. The greatest wealth is having a healthy body and a peaceful life and the right people in your life. Thank you.
So, now I think having had these presentations, now I would like to sort of invite our the international faculty to share their views on this colon cancer. Can I just request Dr. Evelyn Decker to share her views on this colon cancer and the importance of the screening? Can I, Dr.
Hello, good morning. My name is Evelyn Decker. I'm a gastroenterologist in the Academic Medical Center in Amsterdam, in the Netherlands. And I'm, first of all, very happy to be here and to share our experiences with you. It has been a great pleasure to meet with all my dear colleagues yesterday, having all the academic discussions. And I like to share with you the way in the Netherlands we are doing the screening for colorectal cancer nowadays. So we've been starting a discussion in my country around 2005, I must say. I was just then finished my residency. I was becoming a staff member in my center, and we were realizing that also we were seeing an increase in the cases of colorectal cancer. When diagnosed late, more difficult to treat. So we thought it would be relevant to try to detect those cases early, which is possible, as you have heard, by doing the colonoscopy, but we also wanted to reach everybody in the population, and it's not like here will be the problem, possible to do colonoscopy in everyone in the population. It's not possible for medical services because it needs too many colonoscopists, but also many people in the country are not so much aware about the risk of colorectal cancer and are also not inclined to show up for a procedure like a colonoscopy. So we decided to do research in doing primary colonoscopy, offering to the population, but also offering a fecal test, like has been discussed already in one of the earlier presentations, looking for blood in the stool as an early symptom, a potential symptom of cancer. The person feels very well, nothing wrong, no complaints, but still there can be cancer inside the colon, and that can be detected also by blood in the stool. Blood in the stool, however, so when there is blood in the stool, is not always colon cancer, but it's a good way of trying to select patients from the population, not knowing they have cancer. So we did pilot programs, and since 2014, after the agreement with the Ministry of Health, we have implemented a nationwide colon cancer screening program using those fecal tests. And we are lucky, in the Netherlands we have a good postal system. So every inhabitant in my country between age 55 and 75 is invited every 2 years to participate in this screening program by mail, by postal mail, receiving that fecal test and a return envelope. He or she can do the test at home and return it back to the laboratory. And if there's blood in the stool, we invite the people in one of the many centers where we can do colonoscopy. We discuss colonoscopy and we hope to be able to do the colonoscopy. About 5% of the population, 4 to 5%, each 2 years is positive and needs the colonoscopy. And once we've done the colonoscopy, we see about 4% colon cancer, but also many patients with lesions that are like you've seen, the polyps, but not early polyps, but polyps that are on the way to become cancer. And I think that's one of the major topics. We detect cancer, but also the bigger and harmful polyps that might soon become cancer. And we can still resect those from the colon, and the patients are checked maybe sometime later in a few years again by colonoscopy, but we prevent cancer. One thing I think that has not been highlighted in my view enough is that also many patients that we detect through such a screening program with cancer are detected in a very early state. So you've heard now some very happy and good stories about patients being treated timely, but still undergoing quite invasive therapy, like chemotherapy and surgery or radiotherapy. And it's fantastic because they still survive. But for many cases now in my country, when we do screening, we detect cancer in stage 1. The earliest stage. And that is about half of the patients with colon cancer now. And that can even very often be treated by us, by endoscopy. So during that same procedure, we can resect early cancers, and that might be enough. So patient does not have to go to surgery, not to chemotherapy, not to radiotherapy. So we have a big chance for all these patients going home the same day or maybe the next day, and they are cured. So we are very happy now. I've presented yesterday the results of our program, and we now have seen both incidence of colorectal cancer in my whole country and also mortality decreasing in my country from colon cancer. And that's also due because we put so much effort not only in the program but also trying to explain to the lay public that it's relevant and important for them to participate. We have now between 60 and 70% population-wide participation. And that's one of the part of success, because you can offer a good screening test to people, but if they don't come, we cannot do the right thing. So we need awareness and ideally a nice program to make sure that all the people in the different groups can all participate in such a program. I'm very happy to be here. I think it's a fantastic meeting with all of you, and I wish you good luck. Thank you.
So I think you've heard Dr. Evelyn Decker to discuss with you about what is the issue in her country, and probably this must have given you a lot of important message. Now let me invite Dr. Bharat Somsundar Bharat. He is one of the senior most gastroenterologists from US to give his views briefly.
It's not 12 yet, so good morning. Few things, just a few comments I would like to make. When it comes to prevention for anything, especially with reference to colon cancer, one is primary prevention, the other one is secondary prevention. Primary prevention is doing things right so that you don't get cancer kind of illness, especially related to colon cancer. This involves the risk factors for developing colon cancer. Some examples, obesity. So it may sound odd, but it's better to be lean and mean rather than being flabby and happy, because obesity is definitely a risk factor. And everybody here knows that if something tastes good, it's not good for your health. So we got to make some restrictions and we got to make some sacrifices to live longer. Cigarette smoking is very bad, not only with reference to colon cancer, for a lot of other reasons. You smoke one cigarette, you lose 20 minutes of your lifetime. So no smoking is the way to go. Alcohol, again, it seems to be getting more and more rampant in India. We see the consequences already. And alcohol is bad for the liver, for a lot of other illnesses, and also a lot of calories too. So I think those are the things which we have to emphasize when it comes to primary prevention. What we are talking here mostly is the secondary prevention. That is, there are certain illnesses, when detected early, they can be cured. And the dictum that went on years ago when we did not have treatments, cancer meant death. Well, that's not the case. Even advanced cancers can be treated. Early cancers can be cured. And if we know about some of the precancerous troubles, and if we take care of them, we actually prevent cancer coming up at a later time. And that is the emphasis we are making here, that colon cancer is preventable. We see in the United States already, we kind of screened people above the age of 50 with colonoscopic exam, and the incidence of colon cancer is coming down. But unfortunately, at the same time, we see more and more of younger people coming up with colon cancer. And in India, usually any of these illnesses, when we compare to the Western population, it seems to come about 10 years earlier. So that means even younger people here, they are prone to develop colon cancer. Colonoscopy is the most sensitive way of finding out these precancerous lesions. 95% of all these lesions can be detected. And as discussed before, if we find these lesions and remove, we actually prevent cancer coming up at a later time. There are some genetic factors. Of course, we don't have the fortune to choose our parents. So genetic factors, there's nothing much we can do. But as far as environment goes, we can do a lot of things to prevent illnesses, especially here with reference to the colon cancer. So the final thing I would say is it's a preventable illness. Not in all, but in quite a few. The main thing is we have to look at the local situation as to how it is possible to do it, because logistically it can be a problem, as discussed before, doing colonoscopic examinations on huge populations. Thank you.
I think you heard the practice in the United States. Now let me call upon Dr. Motofik. He's from England to tell us what the scenario in England, quickly, briefly.
Very briefly. Yes. So I think you already heard everything. I think everybody said. I won't say the same thing again. I'm originally from Chennai. I actually went to MCC school. I played tennis with Leander Pace. I wasn't a good tennis player, but I think I was a good endoscopist. So I think 3 points I'll make. Cancer starts as a small problem, a small problem which you're not aware of. It's like going on a bike, you wear a helmet, because not every time you're going to get an accident. That's you're preventing. That's what you have a screening program for. That's similar to a colonoscopy or having a fit test. That's what we're trying to say. And second thing I'd like to say is screening detects cancer at an early stage. Most of the cancer which detected in screening program is at an early stage, so you can actually cure it. But the cancer detected after you have symptoms like rectal bleeding or weight loss is often detected at a much later stage. So it gives you, your family, the specialists an opportunity to make you better. So who's had a colonoscopy in the room? Thank you. Who has never had a colonoscopy in the room? Who will not have a colonoscopy in the room? Who will never have a colonoscopy? Okay. So the reason is interesting because I think there was only one person in the room, and who doesn't put their hand up for anything? So I'd like to say is things have got better with time. We have better bowel prep. I know Dr. Karthik mentioned about bowel cleansing. 10 years ago, 20 years ago, it was horrible. You will not drink it, even a sip of it. Now it's got better. The scopes that we have is much better. It's more delicate. It's just like watching high definition. The TVs have got better. The technology's got better. And what about endoscopists? They've got better because the training is better. I mean, Mr. Ram is here. He's seen cricketers over the years. We've had great cricketers in the past, but we have specialist cricketers now. We have, if you want to score 20 runs in the last over, who do you need? Dhoni, exactly. So that's why we have specialist endoscopists. So I'll stop there. Thank you, ladies and gentlemen.
Now, let me invite Dr. Shyam Varadarajalu is again from US, just to say about his sort of experience or his advice on this colonoscopy.
So I have a disclaimer. I don't do colonoscopies. Usually when patients come to see me, and when I go see them, about 20% will start crying because I'm an expert on pancreatic cancer. I probably diagnose the largest number of pancreatic cancers in the world. I diagnose about 1,000 patients a day. And colon cancer, 1,000 patients in a year. Colon cancer is not my specialty. And actually, when you compare it with pancreatic cancer, it's actually a much less serious problem. But it's a more prevalent problem. Pancreatic cancer, cause of death, 10th largest mortality in the world is from pancreatic cancer. Colon cancer is number 4. Pancreatic cancer is extremely difficult to diagnose. When a patient has symptoms, they almost die. 5-year survival rate for pancreatic cancer, even in the Western world, is 10%. In undeveloped world, is close to 1 to 2%. No treatment is usually effective. Colon cancer is exactly the opposite. There is a screening program. For pancreatic cancer, we don't. For colon cancer, you've got a screening program. For pancreatic cancer, you have to go to real experts And sometimes I see patients referred after the Mayo Clinic and the Mass General, and they've got problems, and then they eventually come to me because I write the textbook on the technology for diagnosing pancreatic cancer. Colon cancer, no. Every gastroenterologist can do a colonoscopy. It's a simple test. It's much more cheaper. Pancreatic cancer is diagnosed late, and when you diagnose them, everybody goes home crying. Colon cancer is not the case. Even if you diagnose them at an advanced stage, chemotherapy, radiation, surgical option, multidisciplinary treatment, there are so many options available. But one of the challenges that is particularly relevant to our population is, in the United States, 40 patients in 100,000 have colon cancer. So we have very good data to implement screening guidelines and so on. Right now, the problem in India is that we don't have such kind of data because we have not invested in research, because we have a very huge population. So that is one. The second is, I think you've heard throughout this day about sedentary lifestyle and food and everything. Remember that these are associated factors. Just because you're not taking enough vegetables doesn't mean you're going to get colon cancer. These are all associated factors. The third is, you also saw the study that was presented to you that told you patients with lower economic status get colon cancer. Not necessarily true. A lot of rich people get colon cancer as well. The reason is because you went to public hospitals where patients are uninsured and you see them, it's more likely you will diagnose colon cancer in them. Not. So colon cancer can happen to anyone. Ronald Reagan had colon cancer. So many of our former presidents had colon cancer. And therefore, do not go with the impression that if you are with a higher socioeconomic status, this disease is not going to get you. And then also there should be simple things that will trigger. If you're getting older, you've got a family, so you can ask, when do we start these guidelines? Anybody with a first degree relative, you've got some other cancer, your family has got somebody with associated cancer, you've got new bowel symptoms, a lot of things will tick the marks. Then you must go and have a surveillance procedure. But I think personally, for somebody like me who does a lot of clinical research, and for Evelyn, this is a prime area, 20% of the world. To look at this population, we know that not everybody can get a colonoscopy. To come back and find the denominator on what the problem is, and from there to implement guidelines like different fecal testing, DNA testing, and so on, will help us advance this field. And this is a great, unique opportunity to take it as a challenge and to move forward. And anything else, sir? No, thank you.
Thank you, Shyam. I think, don't think that we are all pushing you for a colonoscopy. And only the preventive health checkup is most important. And even at the basic, with the preventive health checkup, we should at least do a stool examination for occult or invisible blood. That may give a guide. The last patient who just discussed about it, he was only 45. He just went for the regular health checkup. Stool examination showed occult blood. And he went for a colonoscopy that showed a cancer. He got operated. He's all right now. So next, I think I will call upon Dr. Raghuram. Just a quick. You have heard from various other countries. Let us hear from India.
Good morning. I may have some different views. Our people think any blood in the motion is piles. They go on from doctor to doctor thinking it is piles. It may be piles or something else. Majority of my patients have diagnosed rectal cancer comes to me with piles. When I do a rectal exam, I feel the growth. Not even colonoscopy, just rectal exam, I feel the growth. So this misnomer should go away, that any bleeding per rectum is piles. Anything around the anus is piles. That misnomer for the public, it should go away. If you spread that message, that we're fine. So they are talking about 40s. I had a patient at 25 and he had a cancer, sigmoid colon. He's still living. Then I had another doctor who is 35 who had a cancer colon. He's still living. So it is more than 45, 50 years. So it's not a bad prognosis. Nowadays, there is a epoch-making oncology advances. They can still treat you without surgery. I recently had a patient who came to me with a COVID. During the season of COVID, nobody was doing any procedures. I just did a rectal exam. I said, you've got a growth, you better go have a colonoscopy done, and treat accordingly. He comes to me last few days back and says, I'm all right, no surgery done. No surgery done, his rectum is intact. In those days, they would have disconnected, put an ostomy. So advances are there and we should utilize it. That's what I will say, utilize it. People have spoken about fecal blood. I've been very constant saying any motion exam, not just routine, do an occult blood. Occult blood is as good as that fecal immunochemical test, which interacts with globulin. That's a little costlier test. This is cheaper test. So I will advise all of you, when you go to a routine muscle checkup, people say that they don't do the motion exam. There's some lady picked up, they're very difficult to take the motion from the European closet. I think when there is a will, there's a way. So you must do do the occult blood for the routine examination. That will give you a clue. We cannot be screening everybody on the road for a colonoscopy. Occult blood is a simple test, they can do it. If it's positive, go for colonoscopy. Thank you.
Thank you, sir. Now I would request just a quick online or a two-liner comment from Dr. Ratnaswamy, is a senior surgical gastroenterologist. Can pick up mic, sir. You have a mic there. Is the mic on?
மலக்குடல் தமிழில் பேசுகிறேன். இனிய காலை வணக்கம். மலக்குடல் புற்றுநோய் என்னுடைய மெடிக்கல் கேஸ்ட்ரென்ட்ராலஜிஸ்ட் கொலனோஸ்கோபி பண்ணி கண்டுபிடிச்சி அதை எங்ககிட்ட அனுப்பும் பொழுது நாங்கள் அந்த குடல் பகுதியை வெட்டி எடுத்துகிட்டு இணைச்சிட்றோம். இது மலக்குடலினுடைய எண்டில் இருந்துச்சுன்னா இணைக்க முடியாது. ஸோ அதை எடுத்துகிட்டு வெளியில் இங்கே குடல் கொண்டு வந்து வைக்கிறோம். அது பேர் ஆஸ்டமின் பேர். இதுதான் நாங்கள் 40 வருஷமாக என்னோட டீச்சர் டாக்டர் ரங்கபாஷியன் காலத்திலேருந்து நாங்கள் பண்ணிட்டு வர்றோம். இது சில சமயம் ரொம்ப வளர்ந்து குடலையே அடைச்சிக்கும். அந்த சமயத்தில் எமர்ஜென்சியாக சர்ஜரி பண்ண வேண்டியது இருக்கும். அந்த குடல் எடுத்துகிட்டு ஒரு ஸ்டேஜரி 2 ஸ்டேஜில் 3 ஸ்டேஜில் பண்ண வேண்டியது இருக்கும். இந்த மலக்குடல் இருக்கிறது சில சமயம் அது வளர்ந்து பரவும், லிம்ஃப் நோடுக்கு பரவும், லிவருக்கு பரவும், பிளட்டில் பரவும். ஸோ அந்த மாதிரி சமயத்தில் குடலில் இருக்கிற புற்றுநோயோட அந்த லிம்ஃப் நோடையும் எடுத்துருவோம். சம்டைம்ஸ் லிவருக்கு போயிருந்ததுன்னா அந்த லிவர் போர்ஷனையும் வெட்டி எடுத்துருவோம். இதனால் எங்களால் குணப்படுத்த முடியுது. இதில் இந்த ஸ்க்ரீனிங்கில் என்ன அட்வான்டேஜ்னால் ஏர்லியராகவே கண்டுபிடிச்சிடலாம். ஏர்லி ஸ்டேஜில் கண்டுபிடிச்சிச்சுனாக்கா சர்ஜரி பண்ணுறது ரொம்ப ஈஸி. சில சமயம் சர்ஜரியே பண்ணாமல் இது மாதிரி எக்ஸ்பர்ட்ஸு கொலனோஸ்கோப்பிலேயே அந்த போர்ஷனை வெட்டி எடுத்துருவாங்க. சர்ஜரியே வேண்டியது இருக்காது. இன்னும் இந்த சர்ஜரி மட்டும் இதுக்கு போதுறதில்லை. இதுக்கு ரேடியோதெரப்பி கொடுக்க வேண்டியது இருக்குது, கீமோதெரப்பி கொடுக்க வேண்டியது இருக்குது. இப்போ 4வதாக இம்யூனோதெரப்பின்னு ஒன்று வந்திருக்கு. அது கொடுத்துட்டு நேற்று தான் சொன்னார் ஒரு டாக்டரு, இந்த கோலன் கேன்சரை க்யூர் பண்ண முடியுதுன்னு சொல்லிட்டு. பட் இந்த மாதிரி அட்வான்ஸ் ஸ்டேஜுக்கு விடாமல் ஏர்லியர் ஸ்டேஜையாக கண்டுபிடிச்சிட்டா 100% க்யூர் பண்ண முடியுங்கிறதுக்கு இந்த ஸ்க்ரீனிங் உதவுது. தேங்க்யூ.
Thank you, sir. Next, I think Dr. Venkatakrishnan is Professor of Gastroenterology from PSC Medical College in Coimbatore. Just a quick one-liner, sir.
Thank you, sir. I think most of us have gone through all what is the incidence of colorectal cancer in India. It has to be emphasized that presently there is a rising trend in India and younger age population is really getting affected. And as Dr. Raghuram was saying, I think most of us, I see many people going to master health checkup and most of us come to us with fatty liver and asking us what to do with the fatty liver. But I think probably we should incorporate the stool for occult blood. And the importance of that is if it's positive and we do a colonoscopy and pick up these malignancies at a younger age or early, then you are reducing the death rate by at least 20 to 25%. Maybe that's some message I want to see. Rest of it, I think most of it has been covered by the rest of the speakers. Thank you.
Next, I would request Dr. Colonel Krishnan is the senior most gastroenterologist and he is the founder of gastroenterology in Apollo Hospital. Just a quick few words about this colon cancer, about his advice.
Yeah. I wish all of you visit Srivilliputhur and go around the temple. There are entire Prakaram is full of paintings. And one of them says, Varumun Kapon. You should prevent any adverse event before it happens. So it is not something the 21st century, we are inventing, or people years, millennium of years ago have thought about this concept as for healthy living. Second thing is, we talked about yesterday, and doctors are expected to only diagnose and possibly treat and cure. The other aspect of prevention and possibly predicting disease. In the prevention, I think the general population owes about 75%, whereas the doctors come in only 25%. If you don't come up with a problem that I may not have cancer, and you are not willing to subject yourself to procedures that will detect the cancer at the earliest possible stage, the fault is as much as in you as the doctor. In our country, as everybody said, that it's not possible to do the plan of colonoscopy for the entire country. That's out of question. That's, I think, almost foolish. The next only problem that I say is, including the Tamil films, Hindi films, the word cancer creates a certain scare in you. If we want to create a pathos, even Mani Ratnam does it. He had cancer, as if that's a death warrant. Let us, if I were the censor board, I'll cut that anyway. That's a different story. So let us go away from the concept that cancer is a death warrant, heart attack is, and cancer, as everybody said, is diagnosable these days, not in my father's days in Srivilliputtur. Cancer is treatable, and if on many occasions it's curable. I take home this message that we must, like you do your polio vaccinations, your diphtheria vaccination, tetanus vaccination, etc., you must also, in the preservation of your health, you must allot a certain identity that you will attempt all measures to prevent any possible cancer in you, in particular colon cancer. Thank you.
Thank you, sir. This Mr. N. Ram of Hindu is with us, and yesterday we had a scientific meeting. Mr. Ram was our chief guest during the inaugural program. Maybe I would request his comments and advice. Can you hand over the mic to Mr. Ram?
Thank you. I just came to get a sense of this awareness program because we spoke about it yesterday, and this is exactly what needs to be done. And also I was pleased that one of you spoke in Tamil. It has to be in Indian languages. Of course, it's being done. What I didn't say yesterday was the opportunities available in the social media, particularly YouTube. I don't know how many of us are aware of the fact that India has the largest number of YouTube users in the world. Also WhatsApp, also Instagram, not Twitter. So I think, there's a lot of disinformation and misinformation on those platforms. And they get weaponized if it's disinformation and scaled up. So it's very, very difficult to combat it. The other side of the coin is it provides wonderful opportunities for those like Professor Panisamy and others to speak to the public and raise awareness. So I think I just came to get a sense of what you're doing. I had something else earlier, and I think this is very impressive. It has to be taken to small towns, rural areas, and so on. And I'm sure I again reiterate my admiration for our finest physicians and surgeons who are represented here, and also appreciate the time taken by our international faculty come here and also participate in this awareness program. I thought I'll just say that, and thank you very much for doing this.
So, thank you very much for having taken off time on a Sunday and for being with us today. Next, I shall probably I'll pass the mic to some of our patients to share our experience. First, can I request Chandrasamy can I hand over to Mr. Chandrasamy?
Morning. My name is Chandraswamy. I'm the Chief Executive of Procter & Gamble, and I'm 79 years old. I first got information that I had colitis. It was when I was 40 years. And from there, I'm in the safe hands of Dr. Palaniswamy. I'd like to share my personal experience of what I do when I have colitis or colitis attacks that comes and goes. One very important thing that I found, besides alcohol and smoking, is exercising. And I do yoga practice. I'm a yoga qualified person from Iyengar Institute in Pune. And I find yoga is a very good example and a treatment for this kind of colitis that we have, because I feel that is a lot of pressure driven, especially at work. And it shows itself in this form of colitis. And the second thing that I found very useful to me was turmeric. Having turmeric capsules which come now. Earlier I used to have a turmeric grind and put in milk and drink it, but now it comes in capsule forms. It's very convenient. And I find that if I have turmeric regularly, 4 capsules a day, I find it soothes my colon a lot, and I feel much more comfortable. And I know that when I'm going to get an attack, I go running to Palaniswamy because I don't want to get into trouble, and I get examined. And I do this very regularly. Once in 6 months, I always go see him and talk to him. Alcohol is always an issue which we have to be very careful, especially when I travel a lot and I handle international business. Alcohol and food habits together when you travel does have an immediate effect on my colitis. So I know that it is not something is going to happen. So I always take precaution. I always have Tair Sadham before I go to any conference or any meeting. I go to my hotel, order some yogurt, plain rice, fill my stomach up, then I'm safe. So this is one of the things I do. Thank you very much. And
thank you, Mr. Sami. Next, I shall pass on the microphone to Mr. Kunal Banker. And I think Kunal Banker has had several colonoscopies. I would probably request him to tell you about his experience on colonoscopy. How was it comfortable? Will you advise colonoscopy for all of us? Yes, Mr. Kunal. Can hand over the mic to Mr. Kunal. Yeah.
Thank you, Doctor. Good morning. First of all, it is such a pleasure to see Dr. Colonel Krishnan here, who treated me since I was a young boy. It's a joke going around with all my friends and family members that, what is it? Why do you like the tube going up? What is it with you? We don't understand. So I said no, and I've done a colonoscopy every year. For the last, I guess, maybe 5-6 years, I have done a colonoscopy every year. And the reason is that I travel a lot, and I keep coming back to doctor and said, I don't know what it is, but I keep going to the toilet all the time. Everything I eat keeps coming out. What's the problem? And then he said, well, you got IBS, you've got an inflamed colon, you've got polyps, you've got this, you've got that. I said, so what do I do, doc? He said, well, do a colonoscopy, do an endoscopy. And I did that, and it helped a lot. And to me, I think it's very, very important to get a colonoscopy or an endoscopy done at least once a year after you've passed a certain age. I mean, it's...
No, I don't think I will advise you once a year.
I like to do it.
You volunteer yourself.
Yeah, but I do it because I get very nervous, I get scared. So I've done it many times, and it's not painful, it's not uncomfortable as people say it is, and as everyone said on this panel, prevention is better than cure. It's better to find this out at an early stage, especially the way we live our lives today, our lifestyle. I think it's very important.
Thank you, Kunal. I think Mr. Nanda Alaganan is sitting next to Mr. Kunal Banka, and maybe you can share your experience on colonoscope.
Actually, this is the first time I'm coming for all this. My father had colon cancer when he was 55. He went to New York, had it out, and he lived another 30 years after that. So, I came for a routine checkup last year, and I think I have a couple of polyps.
Yeah, I think that needs to be removed now.
That has to be removed now.
Yes.
And yeah. He's not giving us time, so anyway.
Maybe I should be free for another few days. I'll probably give time. Yes,
That's right. So thank you.
Can I request Mr. Swaminathan, I think sitting behind, can you hand over the mic to Mr. Swaminathan?
Morning.
No, I think there are two Swaminathans. I meant the other Swaminathan. Maybe you can share. Yeah.
But I can share my experience in the sense I normally have a good friend, Dr. Palaniswamy. Whenever I have a problem, either in the head or in the foot, I ask him. And once I went to him with a stomach problem, and he said, I would like to do an endoscope and colonoscope. I didn't know what it was, but I had it done, and I am very happy and healthy, and I continue to be under his care. Thank you, Dr. Palaniswamy.
So over to Mr. Swaminathan, yes.
Good afternoon, everybody.
The mic is it.
Hello. Good afternoon, everybody. I am Swaminathan. I am 80 years old. During 2011, I undertook that colonoscopy, and they diagnosed colon cancer. I was given treatment, and of course, within 6 months, I was cured. And
so the mic closer, the mic. Yeah.
I was cured, and I came to my routine right from September that year. I am still active, and I am going to office every day. I am 80 plus. Thank you very much.
Thank you, sir. Thank you. So now I think it's open. Probably anybody who volunteers to speak. I think I see a homeopathy consultant, leading homeopathy consultant sitting with us, Kushali Gambhir. Can you just talk to us, share your views? Do you refer for colonoscopy? Yeah, can you share? Yes.
Hi, thank you for this lovely opportunity and lovely awareness program, such a much needed awareness program. And I totally agree that colonoscopy is an important factor. In fact, sometimes some of my patients, being a homeopath, sometimes some of my patients says, how come you ask so many investigations? But the fact does remain is when you investigate, you identify, and you identify very early. I am lucky that I get patients from all walks of life because they come for general wellness, and when I do investigate, I've kept them really young, got the lesion young, and I guide them rightfully to the right direction. So I'm quite happy to be able to be doing that and keeping myself updated on it. Occult blood, like was mentioned, is something that is so necessary. And all it takes is a referral, writing stool routine culture with occult blood, and that's about it. So, and today we are living in an era actually of a lot of stool analysis and DNA analysis, and any of the labs can do a fecal calprotectin. It's very rampant now. And on the post, again, it can be done via post. So these are ample opportunities for us to screen, and screening is the gold standard. Screening in whichever pathy you are practicing, screening is the gold standard, must be required always for all kinds of illnesses.
Thank you. We have Dr. Subhashini, who is in charge of the preventive health check at Apollo Hospital here. Can I request somebody to hand over the mic? I think many of you may have seen Dr. Subhashini in the health check area.
Good afternoon, everybody. It's a pleasure to be here, and I see a lot of my patients on stage and seated here. So it was a lovely event, and I think there was a lot of focus on fecal local blood and rectal bleeding. There are other symptoms that one needs to look for: unexplained weight loss, altered bowel habits, having diarrhea or constipation alternatively. Any of these symptoms more than 6 weeks, you would need to see a doctor about it. Of course, I would take Dr. Venkatrakrishnan's advice on incorporating the stool local blood for over 50s in the health check. Thank you for this opportunity. Stay healthy.
Thank you, doctor. Now it's open for I think any of you can come forward to give your views or comments or the advice. I don't see anybody raising the hands. Only I see Subba Reddy rubbing the hands. Yes, sir. Can I hand over the mic to you, sir? Yes, Lakshmi, yes.
There's a lot of nutraceutical advice with regard to probiotics. What would be your advice, doctor, on the use of regular probiotics, daily use probiotics in improving gut health?
Daily, I think probiotics, of course, is very important, essential, I agree with you. And in your normal routine, the diet itself, you take yogurt and there itself you get your all needed required probiotics. I don't think there is a need to take regular probiotic tablets.
Okay, yeah. Would it improve gut health?
Yeah, definitely, it does help to improve the health, yes.
Okay, yeah, thank you.
Yes, Dr. Prasad. Mike, hand over the mic, please. This is Dr. Mohan Prasad. He is the senior gastroenterologist from Coimbatore. He is running his own GI center called BGM GI Center. Recently, he started the transplant for the kidney and liver also.
Very grateful, sir. My teacher, under whom I studied between 1985 and 87 at Madras Medical College. So, adding on to Madam's comment on probiotics and adding on to Sir's comment, nama palaya soru, so thanni ஊத்தி வச்சு morning எடுத்து the supernatant fluid, if you take, that is very rich in bacteria, good bacteria, the probiotics, which can prevent colon cancer. And I would like to add on to Professor Krishnan's word, like what Thiruvalvar said, Varumun Kapan, no, sir, what is that? Illa, sir, no, sir, one second. Varimunnar Kavadan Valkai, Erimunnar Veituru Pola Kedum. So prevention is better than cure. If you don't prevent diseases, this is like a haystack displayed in front of fire or kept close to fire. That is what Professor K.R. Panisamy has taken the crusade. Like I would think that he has initiated the Kurukshetra war against the colorectal carcinoma. Please give a bigger round of applause. And he is the warrior, Arjuna, and we have the charioteer, who is our own Radhe Shyam Varadarajulu, who is Krishna, who is the charioteer, who has made this 2-day program possible here. So amazing. One more round of applause to these people.
Thank you, Dr. Prasad, for this excellent comment. I think we have almost come to the end of this program. Now I will request Dr. Mohan Prasad to propose a word of thanks.
Well, my namaskaram to everyone and my salutations to all the leaders here. And for our international faculty, Dr. Michael Burke, who went back to Australia early this morning, and Professor Evelyn, who has come all the way from Netherlands, and Professor Taufik, who has come all the way from England, and Professor Bharat, who has come, our own Professor Bharat from Chennai, who has come back from US, and my teacher, Professor Raghuram, and all my colleagues on the stage, and most respected Mr. Ram from the Hindu, who was our chief guest yesterday, and my salutations to all the VIPs of Chennai. So you made the day I think now the request from all of us here on behalf of the Tamil Nadu Gastroenterologist Trust, I'm the Vice President, so Sir made me the Vice President. So on behalf of all of us, our request to you is each one teach 10. Now this message should not stay here within the four walls. I think you should talk to all your relatives and friends to have some screening programs, if not colonoscopy, at least a fecal occult blood test once a year. And if anything is positive, then you can take it forward. If there are relatives from your family who have some cancer somewhere, always please look for cancers in your body also, because please remember, man is the perfect creator, whereas God is the most imperfect creator. We can make 100,000 radiator caps, for which TVS was awarded by the, I think the General Motors way back, for perfect, precise technology. But God can never create a perfect, precise human being, because inside a lot of problems which are genetically, codified, and then environmentally we buy trouble. So the whole mission taken up by Apollo Hospitals, the entire team of Apollo Hospitals, and the Tamil Nadu Gastroenterologist Trust, is to take this message, which is very dear to the heart of my guru, Professor Padma Shri Dr. K.R. Palaniswamy, that the whole place should be a beautiful place to live in, and prevention is always better than cure. Cancer, colon cancer, is preventable and curable if detected early, and treatable if detected. So I don't think, and many people, are scared of the word cancer, scared even of the word biopsy. We see in our clinic, you say, I've taken a biopsy and sent it to the pathologist. Immediately, somehow in Tamil it's called bayam. So the biopsy word itself tags on bayam, and the biopsy going to the pathologist creates pathos in the family. So they're all scared. 4 days they're dead scared before they come back to you saying that, oh, you could have asked me. I just did it just for a routine biopsy screening, and we never suspected cancer in you. Said, oh my God, you are God. Thank you so much. And people have literally not slept for 3 days until the biopsy report comes. I don't think we should do away with all this, and that is why the whole program has been done. And thanks to the Pullman group of hotels for making such a beautiful ambience, and to Stage 3 Santosh and the team for a wonderful program today. And the whole of yesterday was full of deliberation and a feast to all the gastroenterologists of the city and outside. And today, to the elite of Chennai, I hope Professor KRP's mission will be successful. My humble appeal will be to take this message to each one, teach 10 or even 100. It'll make a lot of difference and make this world a healthier place to live in. Let me just thank all of you for your august presence here. Thank you so much.
I would like to once again thank all our friends and guests for their presence and the time. An excellent lunch has been planned by the Pullman Hotel, and I would like to thank Mr. Subbareddy and the family. They have planned an excellent menu. I would like to request you to join us for lunch and enjoy the lunch.